Today, we talk about what to do. Same disclaimer. Any and all information coming ahead in this video are purely for edutainment reasons. This is not a substitute for you seeing a doctor. This is not a substitute for, I don't know, all that mumbo jumbo lawsuit, day-to-day bullshit. This is really just pure entertainment, and hopefully you learn something. And if you have further questions, please refer to a doctor that you can meet in person, because I'm off duty, bitch. Anyway, so no offense. I hope no one took offense to that. I was just trying to be funny. Yeah, so celiac disease, what it do? Again, this is a very complex topic, but just to break it down quite simply, everyone's heard about gluten. Everyone's heard about gluten intolerance. It says along that same spectrum where basically it's like an autoimmune condition. Basically, your body's immune system is attacking itself because it doesn't recognize itself as itself. It thinks it's a foreign threat that it has to neutralize. So it starts attacking your bowels, classically your small intestine, when it's exposed to gluten, because it gets all kinds of wacky, fucked up signals. Now, again, this is very simple. Now, what'll happen is, for the most part, the fix for it is to just go on a gluten-free diet, which is not the easiest thing to do, but it is becoming overall a little bit easier because it's entered the mainstream. You get a lot of celebrities and fad diets that incorporate gluten-free-ish, and you see it in a lot of more menus these days than you ever did before. I don't encounter celiac disease a ton. Obviously, I encounter it more than any other specialist because I'm the one they come see. But as far as like the overall patient population of the types of conditions I see, celiac disease I don't see a ton of. Which is kind of good. Usually whites of European descent, from what I recall in medical school, are the ones that are affected the most commonly, but I've seen whites, blacks, Hispanics, whatever, with celiac disease, so, it can happen to anybody. Now, the quick and simple fix, quote unquote, is just being on a gluten-free diet. Don't expose yourself to gluten, your immune system doesn't go haywire, and you live pretty good. Potential long-term side effects suggested, like infertility. That's usually the big scary one that helps people get motivated to stick to a gluten-free diet, especially men. But a lot of other things can happen too. Main side effect can be diarrhea, malabsorption of nutrients, because your intestines are just not doing what they're supposed to do. But yeah, sticking to a gluten-free diet is the quick and simple fix. Some patients do unfortunately end up in a state where they require much heavier medications to suppress their immune system. But again, that's fairly rare. Not so common disease. I don't have exact numbers. I'm not trying to get into a whole medical lecture here. Just trying to keep this fun and light. But I will say a little bit of a tidbit, which a lot of patients end up not recognizing, is a lot of the pills that you take for whatever medical condition you have other than celiac disease sometimes contains gluten in the pill casing. So we want to be very mindful of that. I think it's a great idea. Anyone that gets diagnosed with celiac disease goes and sees a dedicated nutritionist or dietitian to assist them with how to stick to this diet. Because again, going from not sticking to a gluten-free diet to now going gluten-free is a big change. So you got to be prepared for that. You got to understand how involved it is. There's going to be so many things you had no idea gluten was in. Man, I do not wish celiac disease on anybody. But yeah, that's the tough part, sticking to that diet. So hopefully that helps. If you have more specific questions, maybe in the future, as I start to develop this medical content a little bit better, a little bit more focused, a little bit more professional, we can kind of go a little bit more in depth. But for now, hopefully that helps, and we'll see you next time. We out. Bye.